Hello, welcome. Thank you for being here. My name is Dr. Mike Henderson. I am a board certified medical doctor. We are doing lifestyle medicine and functional medicine here in Bentonville, Arkansas. Today, our goal is to understand the 30,000 foot view of mold and mycotoxins. There's some common misconceptions out there. This is, again, a very high level overview, and the goal is to just bring awareness and let me help guide you along the specific path if this is something you feel is you are working through. This is not medical advice. All things should be checked with a qualified medical professional that is your own, and I will not be able to answer any medical related questions in the chat below, but if you're my patient, you know how to get a hold of me, and excited to help you. Here we go. So first of all, the purpose is, what is mold? Where is it? What are the symptoms that could relate us to or help guide us to say, hey, let's start looking into mold testing and seeing if this could be the culprit? And then what are the next steps after someone is diagnosed with mycotoxin related illness? So why this matters? Yes, it's not always front of mind in medicine. In Western medicine, and yes, I am MD trained and board certified, mold is not really thought of by a lot of providers, especially in their differential diagnosis. And usually it's pulmonologists, and usually it's when people have significant respiratory symptoms. Say, all right, let's go down the mold route. But mold exposure, and I'm going to show a study that was done in Finland, can have significant symptoms. And so it's just a reminder that it can be one of the causes of some of your symptoms. So anyway, it's not to cause you worry where it's like, oh no, I have some symptoms, I got to get mold tested. I don't think that's the route that every individual should take. It's, hey, maybe this could be contributing. All right, so what are some of the symptoms of mold? And specifically, we're going to say mycotoxins, which I'll get into a little bit. So fatigue, brain fog, sleep issues, this is called the great mimicker. And there's a lot of individuals in the world with a lot of these types of symptoms that are diagnosed with fibromyalgia or chronic fatigue syndrome and these other non-specific diagnoses. It's more of a constellation of symptoms, and they're given a diagnosis, and it's just sometimes we can get more to the root cause, and that's our goal. Asthma, cough, digestive, abdominal pain, bloating, mood changes, and it's tricky because yes, this is a huge grab bag, like a lot of different symptoms. Like, well, it could be mold. Well, that's why it's helpful to work with a physician and kind of narrow that down to find when it is, if it's the right thing to focus on, if mold is the right thing to focus on. And just to that same point, there's also viruses, there's also bacteria, there's also parasites, toxins, nutrient deficiencies, genetic cancers, so many other things that can cause these symptoms. So it's also important to not get so myopic or one-track minded in, oh, it's got to be mold. Let's keep a 30,000 foot view, and let's be thorough in our investigation. All right, so some of the risk factors that would lead a physician or someone, usually a functional medicine doc, to start looking for mold and mycotoxins would be like a plumbing leak or flooding, musty smell. Where would mold be likely to reside, and are you in that environment? And yes, there's even been patients that they come home, they feel fine, but every time they go to work, especially on a Monday or Tuesday, they feel ill. Come to find out there's definitely mold inside the HVAC unit. It's been an old building, and the study that I'm going to reference is was actually in a hospital setting with mildew and a lot of water damage, and that was where they had their mycotoxin exposure. So people wonder, what is mold? Mold is that chalky, fuzzy, little hairy, looks kind of hairy when you look at it, when there's a lot of it. That's mold. And in the same kingdom or of mold is fungi. So you have basically like a big pitcher is fungi, and you have mushrooms in that, you have yeast in that, lichen, and those are somewhat similar, but that's not mold. Mold is that fuzzy, chalk-like growth on usually decomposing material. And you can get things in the home that decompose. Your drywall, your carpet, wood. And what does mold love? Mold loves moist environments. That's where it likes to grow, dark and moist. And that is why when we think of water damage on buildings, there's actually spores, and spores are mold's way of reproducing. So mold, it gets this furry, happy self, and it says, I want to reproduce. It sends out spores. Those are basically seeds. They can be in the air for years. As soon as you get this wet, sometimes warm, but wet environment that's also dark and stuff, then those seeds are like, yay, fertile ground, let's now develop my own self and grow. Seeds, from my current understanding, do not cause a significant amount of symptoms, do not create that mold, illness. It's the mycotoxins, which we're going to talk a little bit about for sure, as it's very important. All right, so again, I talked about this, decomposers, spores, talked about that. So mycotoxins are something created by mold to protect its environment, so it doesn't have other bacteria come in. It's like, no, I want this, this tack strip next to this carpet. This is my area. And to claim it, I'm going to send out these mycotoxins. It'll kill bacteria. It damages DNA of bacteria and has this toxic effect. And that's what causes, in many, many instances, the illnesses that we receive and gain and symptoms from mold exposure. It's from the mycotoxins. And there's some common mold species that have these specific toxins. Penicillin, ochre toxin, aspergillus, aflatoxin, gliotoxin. Stachybotrys is kind of the black mold, and you get a trichothecans, and that is the actual mycotoxins of the mold. So the penicillin's the mold, ochre toxin is the mycotoxin, and that goes through it. And so, yeah, there's a lot of different types of mold, but we look at what's the most common and then what is causing symptoms. Something I think is really fascinating is they actually use mycotoxins for immunosuppressive drugs. You have drugs such as Cellcept, which is a mycotoxin. And it's important also to, you can think of that and be like, whoa, they use mycotoxins for immunosuppression. That means I have this little piece of mold on this bread. I'm done for. I'm going to be immunosuppressed. Well, it's important to recognize the dose. And that's kind of where the therapeutic response or detrimental response comes into play. The Cellcept that they're taking nearly every day is the mycotoxin is in the milligram dose. That would be like a beach ball amount of mycotoxin, whereas home exposure or some mild exposure could be as little as a grain of sand. To me, that offers a lot of solace, comfort, encouragement that, hey, look, I was exposed. Well, your body has incredible detoxification pathways, has incredible ways of excreting and eliminating that mold exposure, the mycotoxin exposure. It's, I think, helpful again. Yeah, we do have mycotoxins that are used in drugs. The dose is extremely different than exposure, yet it's important to at least recognize, all right, so some of the effects of the immune system from these different mycotoxins. You have immune defense. We talked about that from some of these mycotoxins. And the other tricky part of this is you can have suppression immune defense or even an overactivation of immune signaling. And so you can think of your immune system sometimes as kind of like a car, like a finite amount of energy, a finite amount of speed, a finite amount of gears. And sometimes the mycotoxin can kick it all the way into fifth gear, racing down the road. and you run out of gas, and it's like, well, yeah, it was activating it, but that poor immune system is just absolutely tanked. It's just deplete, and it doesn't have anything else to give. And so that those mycotoxins are just can be really tricky. And sadly, it can lead to some other symptoms and some other conditions. Just because, again, you think about the immune system as it has its limits, and when you really push those, you can have manifestations of other diseases, and causing or leading towards other diseases is a theory. Mold testing, we're going to get into very, very high level. I'm not going to get into like super specifics here. This is a whole nother discussion in and of itself, but there's a lot of different types of mold testing. You test yourself through urine test. There's different companies out there. Something I really appreciate from some of these companies and human testing of mold in their system is it will also look into the detoxification pathways and deficient vitamins and minerals in there, and some of them even with heavy metals and other like organophosphates and plastics and things that can also be harmful to the system. So you can kind of have like I think of it like, a maid that's like super good at looking at a lot of different areas and saying, oh yeah, and also give some suggestions. There's a lot of dust underneath the bottom of this shelf. Actually, if you move your kitty litter to this place, your cat won't have as much dust, and that helps it. So it's kind of like a really good, really broad view of what's the system of what does it look like inside this body, not only for exposure of mycotoxins, but also like how can we support detoxification best. All right. Next is if it's in the environment, certainly we need to test it and get it out. There's different types of testing that can be done there. And then, yes, there's limitations for both human body testing and air exposure testing. Sometimes it will only test the spores. Sometimes it won't be able to differentiate between, yeah, you had exposure in the past, but right now you don't. And also up here in Northwest Arkansas, there's spores all over the area. I mean, it's a very moist environment. You go out on a nature walk, you can see all types of fungi out there, which show that, yeah, they like moist and wet environments. Same thing, wet and dark environments. Well, so does mold. And so there may be a lot of spores out, but does that mean that we have mycotoxin like hitting the system right now and that's why we're sick? Not always. So each one of these things, it's not like you definitely have this, you got to go full force ahead. It's like it adds a piece to the puzzle, and we kind of put this puzzle all together. All right, and again, we can do a whole thing on that another time. And there's a spectrum, and I get this question frequently from my patients, and it's a very good question, right? Hey, I have all these symptoms, but why don't my family members have similar symptoms? Like, if there's this exposure, well, not everyone gets sick at the same level. And some, homemakers may be in the home a lot more than someone that's traveling and, all going to school or something. There's a lot of little variables, right? How's the detoxification pathway? How has the stress level been for decades before this mycotoxin exposure? All that plays a role. The body is super good at what it does. And also, there's other elements that play into here. It's not all A plus B equals C. It's, hey, here's a lot of different factors, and let's kind of look through it as thoroughly as possible. All right, and also genetic factors, immune factors, just a lot of it. So here's a treatment overview. This is a very broad level, big level. But first of all, get out of the exposure. Either have the home remediated, have different filters, and have replace carpet, find the mold, address the mold. Sometimes when there's just a teeny bit of mold in the area, if there's appropriate face masks and eye covering and things, there are some people that like to get rid of the mold on their own, but certainly it's really helpful to have professionals do this as they're experienced and have appropriate equipment, protect themselves from mycotoxins and you. And it's good to be thorough there. So get out of the exposure, support the detoxification, what the body usually does to fight and get rid of these mycotoxins. Some require binders, other antioxidants. Rebuild the gut and immune system, where it's like, all right, let's bolster this system again, kind of reset it, and then be able to get out that mold. And then calming the nervous system, as that's sometimes on hyperdrive. But little analogy, illnesses can be thought of as like an overflowing bathtub. But here in the concept of mold and other symptoms is sometimes there's multiple faucets, and one of these faucets can be turned on full blast, and when that is mold, well, what do we need to do? We need to turn it off, at least turn down significantly the faucet. Mold's ubiquitous, it's part of our ecosystem, but when it's in hyperdrive, or in a lot of, I shouldn't say hyperdrive, but when it's in abundance, yeah, turn it down, get it super, super low, overflowing, clean up, mop up that mess. And then sometimes you got to pull the plug, and that's with the detoxification. It's like, yeah, let's let a lot of this stuff kind of get through us, okay? So what can you do now? Low barriers. You can check your home for visible mold, musty smells. Air purifiers are fantastic. Sometimes neighbors even have some you can borrow for a little bit. So eating is a huge thing that I support. Nutrition first approach here, and sugar. Just real quick, like look on the back of the label. Added sugar should be super low. Get as close to zero as possible in the day. Okay, and then the processed food elimination is helpful, and then also you can fiber helps a ton. Also cruciferous vegetables. There's kind of a lot to that, which is super fun to get into, but that's some ways to kind of start. Glutathione and some other things can be helpful as well. All right, wrapping it up. So final thoughts. I hope that you feel empowered and at least like increased in slight knowledge. What is mold? Where are some of the, symptoms? And it's from the mycotoxins, and yes, it's still in the environment, and not everybody that's exposed is going to have symptoms. But we'll be getting into a little deeper dive on that. You don't have to figure it out alone. Like I'm here to walk through it with you. If you can be a patient of mine here in Northwest Arkansas, that's like the goal, right? Is to help you through it. I did want to talk about just this quick study. So this was a study in 2020, like I said, in Finland, and they took individuals or nurses that were in a moist work environment, and I thought this was really fascinating. There was a 2.5 time increase of symptoms from those that were exposed to those that were not. The symptoms in the central and peripheral nervous system, so neurologic symptoms, were 6.5 times more prevalent in that moist mold work environment. And then also brain fog was about 5 times more prevalent. And then the musculoskeletal pain was about 2 times as prevalent. Fatigue was 3 times as prevalent. So I just wanted to kind of bring that up because it's just important to know, like, yeah, these things are real. And mold is really difficult to treat. There's a lot of elements to it, and there's a lot of like walking side by side that we do as physician patient to help clear and then test of treatment. So I hope this has been helpful. Super happy to have you here. You made it to the end, and any questions, drop them in the comments below, or if you're my patient, feel free to ask in the open office hours, and we'll have a dialogue discussion about that. Make it a great day. Stay safe. Bye.